Hello everyone, this is Dr. Jaisal here. Welcome to Revising Dentistry podcast. Today we have a very special guest with us, Dr. Ankita Shah. Dr. Ankita Shah is an Airway Focused Dentist, tongue-tie specialist and TMJ expert with 11 years of experience and extensive international training in treating an array of diverse cases from infants to adults. Dr. Ankita is the first Indian ambassador from the Breathe Institute. She has high level of proficiency in treating TMJ disorders non-surgically and with minimal invasive procedures. She is the first and only OC trained TMJ expert in India and Dubai, providing neuromuscular dentistry and orthopedic treatments for TMJ. Dr. Ankita's mission is to help her patients lead a pain-free life, have healthy nasal breathing and a good quality of sleep. Welcome, Dr. Ankita.
Thank you, Jason. Thank you for inviting.
I was doing a research about you, going through your website and everything.
Yeah.
You have a beautiful website, first of all. And there were three very different topics, like in dentistry, what we learn in 5 years. The topics that you have highlighted, it's like something unique. It takes a lot of learning, I would say, a lot of years, putting efforts, and to actually dive deep into these three topics.
Right.
Yeah. So I think it's TMJ, tongue tie, and sleep.
That's correct. Yeah.
So we'll dive into all the three topics today.
Thank you for appreciating what I've done. And it takes a little bit of learning and a little bit of interest towards different diversifications that we can get in dentistry today. Because everything's gotten so monotonous and we are not seeing how dental health is also influencing the whole body, right?
True.
Like it's more holistic. And I think dentistry can really climb pillars if we are looking at everything like
True.
holistically today.
True.
Yeah.
Beautiful. So how did your interest, how did you get inclined towards TMJ? Let's start from there.
Sure.
Yeah.
So I was working, I'm a pediatric dentist as such, but so I was doing pediatric dentistry for many, many years together. And then, there was a whole role of myobrace that came in pediatric dentistry. So I started attending a few, lectures on myobrace, and I was then looking at what is linked with the myobrace, what is all this about, and with my research, curiosity came in, I understood that there's a huge link to tongue tie, sleep, myofunctional therapy. So I started learning all those things. I went internationally, acquired some skills into it. When I started understanding that, there were a lot of adult patients that were asking me that, Doc, what have we done not to deserve this treatment? And I'm like, why am I not doing it for adults? I can go ahead and do it for them as well today.
Yeah.
So that's how I started working with adults on sleep and tongue ties. And then these were the patients which were constantly clenching. They had a lot of symptoms of TMJ. They were looking for help in TMJ in India. There was no great support that these patients got. And I'm like, what can I do to make this better? And that's how I started my journey on TMJ. And that's where we are today. We are looking at holistically every single aspect of how TMJ sleep, or, is it the tongue tie, is it the muscles? What is really affecting them?
Yeah. Beautiful. So, as you said that the patients, even the adult patients came and asked you. So, is there something like the simple symptoms that any of the dentists who are watching this podcast can observe it and connect with it, that okay, this is related to the TMJ or this is related to the tongue tie?
Of course.
What are the symptoms that we as a dentist should observe?
Of course. So, I think let's list down a few common symptoms. There are endless number of symptoms though.
Okay.
But maybe if, we are working with patients who are not inquiring about this, but we are noticing things, then what are the common questions that you can ask them, It could be maybe, are you mouth breathing? Are you snoring? Do you think like you wake up with a gasp? Are you fresh when you wake up in the mornings? Are you like a morning person? You can ask them in these different ways. Do you think you clench and grind the teeth? A lot of patients are aware about it, some are not, but you will notice from their teeth structure. You will see attrition, chips. You may also see some wear and tears everywhere, or they're complaining of sore jaw muscles, or they are unable to open their mouth very big. These are challenges like tongue retraction we cannot achieve while we are doing nice fillings and everything. Dentistry gets challenging. So these are common things that you can ask. You can ask for neck stiffnesses. Very, very common with bad dental health, I would say. Clenching, grinding, I already mentioned. Nasal congestions are very common with tongue ties, especially like stuffy nose in the mornings. Speech, of course, one of them. Posturally, lots to look into, but difficult like to always see on a dental chair. But I would say neck stiffness is one key area that you can start addressing from. When it comes to TMJ, very common signs and symptoms, right? Like start with headaches and migraines, move on towards your ears. So you can say your stuffiness, your ringing, tinnitus, that's your ringing, your pain, sometimes they get your itching. They complain of a lot of jaw pain, clicking and popping. Neck stiffness, again, very, very common with TMJ. These patients are so much in pain that sometimes they don't know where it's coming from. A lot of people tell them it's psychosomatic. A lot of people tell them they go to the ENTs and they'll be like, no, everything's fine. They go to chiropractors, get the neck adjusted, they do physios. But something is relapsing it back.
So do you think that even all these fields that you mentioned, that ENT, chiropractors, and even they should be aware that it is also related to dental thing?
Of course.
Like it's a whole approach, and even they should be more aware about it?
Of course, they should be made very aware about how TMJ is affecting the areas that they are working into. So today when we look at collaborations, for example, if I need to refer to an ENT or an ENT needs to refer to me, I need to understand the problem from his aspect as well, and he needs to understand the problem from the dental aspect as well, where they can say that, okay, this is the limitation, there is nothing more to ENT here, and this is what the dentistry can help you over here. That's when the co-junction or collaboration happens.
Even like for patients, it's a little more relieving and easy to accept the dental treatments that we do if it is suggested through an ENT or through chiropractors.
And also when you look at it from the patient's perspective, like it's hard for them to believe, right, that these pains originate from your mouth. Like when you're on the other side, when you look at them, because no one's talking the same language. So what if everyone like in the medical field is very aware, so patients also get confidence towards where their pain is coming from. Today they just feel disheartened that no one's giving them similar answers.
True.
From their point of view, they're not wrong at what they're saying, right?
Agreed. So let's just dive into the topic that you went internationally. You were trained by Dr. Clayton Chan. He's one of a very renowned dentist, and he's training dentists into G neuromuscular, I would say,
right,
or it's neuromuscular.
So the field started as neuromuscular earlier.
Okay.
There were many institutes which trained into neuromuscular. There are currently also many institutes. But the philosophy of GNM, that's gnatho-neuromuscular, is a little different from neuromuscular. More technical differences, I would say, where how you're reading those scans, where you're taking the bites, the designing of the splints. So there is a difference in that, but more on the technical side, and which is definitely more beneficial to the patients. Because I have seen both the approaches, and I know where GNM takes
a little
takes the best of it, and the results are amazing. Are amazing.
Beautiful. How was your experience with Dr. Clayton Chan? Like how was the course, and how was your experience when you came out of it?
It's amazing. It's not like you need one training. There are multiple trainings into it. There are about 9 modules. I think maybe he's even come up with a few more, which are like about 12 to 15 modules to it. I've pretty much done majority of his modules.
Okay.
So it's not something that one can acquire in one day. It's over the years that you will acquire those skills. And it's all about your curiosity and how you want to learn. I feel like TMJ is a master's in itself.
Okay.
Doing one program alone was not going to be enough. How you're viewing the case, how are you viewing the body with it? There are many factors that you got to view with it to make yourself successful. Yeah, but your base has to be
Very
clear,
strong,
very strong on that. Yeah.
So, as you said, like, you need to keep doing on courses, you need to keep learning. That's like one thing which is very definite in dentistry, I would say.
Yeah.
Like, you should never restrict yourself. That's like, keep learning, because that's why it is called practicing dentists.
And it's amazing. But we say this, but when you look at every other field today, everyone has to upgrade in some way or the other. For us, it is more educational, and for some others, it is more like machine based or skill based or something like that. But it's the same. Every field has to upgrade always.
Agreed. So let's come to your treatment approach. What are the primary treatment options that are recommended for TMJ disorders? Or let's just say, what is your protocol and how do you dive into the TMJ diagnosis part?
Okay. So first, I will take a huge case history. Usually my consults last for like 45 minutes with patients. Yeah. So it goes with understanding or detailing about where are they coming from, what is happening. I will look at hormones, I will look at mental health, I will look at postural problems, I will look at dental problems. Everything goes in my history.
Okay.
And that's when I will come to a conclusion about how I want to treat it holistically. Now, yes, when it comes to diagnosis, clinical diagnosis is one part of it. I would also need some x-rays to view the quality of the joints. I don't need an MRI in every case, of course, unless I feel like I think there's a disc tear or something like that. Is where I would put in through an MRI, but otherwise I would say majority cases I skip it. So I would do those particular diagnostic criterias, then dive towards the treatment. Now, knowing the history, then I would know, okay, do they need oral exercises? Do they need body exercises? Do they need mental health help? Do they need any diet counselings? Because if they have too much inflammation in their bodies, the TMJ is always going to flare up. Are they arthritic generally or deficient on vitamins? So I want to look at that as well. Is the tongue tie causing a lot of jaw problem? Is there really a tongue tie? Because tongue tie is also being overdiagnosed after a point. You do not want to do that. Okay, yes, we've discovered that it is one of an important structure in the mouth which is causing a lot of problems, but you don't want to overdiagnose it as well. And so we look at that aspect as well. We look at the breathing and airway also, because clenching or comes from bad breathing, bad neck and bad hip alignments also, and of course bad teeth alignments as well. So you want to rule out every factor if that is leading to the TMJ. So go towards the causes, and then of course the treatment of TMJ per se would be making like a splint or an orthotic. A lot of people call it mouth guards. The ideal word is called as orthotics. They are made on the lower jaw using specialized equipments. And that's how the treatment of TMJ is.
Wow. And you used a correct word, like holistic. It's a holistic treatment. It's like all in together. And how do patients react? So when you describe your treatment plan or your approach towards it and you make it more holistic, do you think, how do patients accept it? How do they take it? Is it more dependent on like how you explain them, or you like, what is the process? How does it go?
So usually the patients that actually walk into my clinic are the ones who are actually suffering from pain or are actually looking at help from TMJ. I am not the one to tell them that you have this problem. They are coming to me with that problem. So one battle is resolved there for me.
Okay.
I understand in another dental clinic, you are the one to actually deliver them the information. But I would say you can actually tell them that, you have these signs and symptoms. I think you may have this problem. Why don't you go ahead and read a little more about it? Then we can discuss it further. So,
Okay.
let them explore their body, let them understand the level of pain they are in. Are they really looking at wanting help, because it involves a lot of lifestyle changes and a lot of holistic approaches also here. So how much is the patient invested towards that, right? So when I actually deliver the treatment to them or give them a treatment plan, first is my explanation which goes to them. Why are they having this problem? How is this problem caused? How bad is it? What do they want to do about it? How much are they willing to do about it? So that's when it makes me understand where are they in the line of treatment, to how much do I make them do, So
Yeah.
I would maybe, if I feel someone's not very invested towards it, or someone who is overtly invested towards it. Overtly invested will follow every step and protocol very well.
Yeah.
Someone who wants like a quick fix, then they will go only for the splint. They will not look at the other approaches that I'm explaining them, which needs actually their investment of time.
Agreed.
And someone who wants just conservative treatment, then they will only look at the other conservative approaches. They know that it's not like a full cure,
Yeah.
but they are okay with it and it's giving them benefit. In the end, it's all about, is the patient feeling better?
True.
If they're feeling better, that's about it.
Superb. Any of the patient success stories that, like, from complex or from a lot of symptoms, they have gotten on the other side of it, like
Many, to be honest, many. I've had patients come, cry, describe how they feel and from where those pains have gone away. And they're living a better life, right? They sleep better, they're feeling they're not waking up in pain anymore. They're like, we don't remember what symptoms we had. A lot of times I actually have to open their case history and ask them that, hey, you had A, B, C, D, E. Do you have it anymore? Oh,
Yeah.
I don't even remember that I had it. This is the answer that they
Wow.
give. So
it's kind of a little achievement in
it
your
is. And unfortunately, they're really struggling, hunting around for doctors, everyone not being on the same page. You feel sorry for them as well.
Agreed.
You don't want them to be in tears, don't want them to be depressed. And majority of these patients have a lot of stress and anxiety.
Wow.
And that's because their systems are always on a high sympathetic drive. And to get them down is where our holistic approaches are needed, and they need that comforting and understanding from other doctors and professionals as well.
Wow, that's a beautiful this thing.
Yeah.
Okay, going ahead, what are the like, how can the general dentists who are practicing connect with you? Like, do you consult? Do you do it at your place? How do you do that?
See, the jaw tracking machines and all are really big.
Okay.
So it's very hard to carry those machines anywhere.
Okay.
So I have my practice. Happy to connect with any doctor who wants help into it, and they can refer out the patient. I can look into it, be on like a call with them, or keep them in the loop always about what is happening. I do practice out of Delhi also, and I do practice out of Dubai also. So I am usually seeing patients at different locations in these places, but Bombay really gets hard to kind of beat that traffic and
I
reach out
agree with
everywhere.
you.
And ultimately I know eventually like I can't carry those machines,
Agreed.
so it's really tough on that note.
Okay.
Yeah.
As you mentioned, the machines that are into this field, like how advanced, like is it getting more and more advanced, or it's already reached to a point? And what are the technologies that you use in your field into diagnosing and explaining it to the patient?
Sure. So the machines that I'm talking about with, it's mainly TMJ machines. Okay. There is something called as TENS machines. These basically stimulate and pulse the muscles to relax all the muscles. So they look at all the masticatory muscles, neck, shoulder muscles, because these influence the jaw position. Like I can tell you a simple thing. Like if you want to, you can just slouch like this. You will see your lower jaw will go behind.
Yeah.
And the minute you put your neck upright,
It will
you'll see the
come.
lower jaw come forward, right?
Yeah.
So how are these muscles really going to influence my jaw position? It's
Yeah.
interesting, right? It's
Yeah.
just it was surprising when I noticed, oh, this changes, and so that's where like physiotherapy plays a very, very important role before I
Okay.
take actually bites.
Okay.
These TENS machines, they actually sometimes put patients on tents like from an hour, sometimes even an hour and a half. Very, very rare cases I need to put for 2 hours also sometimes. After that, I have something called as jaw tracking.
Okay.
Which can actually visually I can see the jaw movements, where is the disc getting retrieved,
Yeah.
how is the jaw moving, is it moving right, left, front, back, how many where is it going. So tiny, tiny, tiny micro
Details.
details are coming through that jaw tracking machine. I'm seeing visually. I have a radiographic analysis already before. So I tentatively know where the jaw is going to come. So that's my radiographic. Then clinically also I've already seen it where it's going to come. So I'm seeing visually, I'm seeing pre-set idea I have, and I'm also seeing with the jaw tracking
Jaw
machine.
tracking machine.
So all these areas together give me an idea where's the jaw going to be.
Wow.
Then once I find that, we actually put some material there, lock in that bite.
Yeah.
Once I have that, I would again take an x-ray to verify where's the new jaw position, just to be very sure about it.
There are major changes in that.
Yeah. You can visually see it on the x-rays before and after.
Wow.
So that's amazing. And in fact, the patient will give you the feedback, and when I actually put that bite in their mouth, it's insane how the balance of the body changes. I'm actually putting pressure on their hands and checking if they lean forward or no, and without the bites they always lean forward, and with the bites they have so much of steadiness in their posture. There is no leaning. How much ever pressure I put, they are right there, standing sturdy. So just imagine how like a bite is actually influencing the whole body. And post this, we digitally scan this and we send it to the labs. Then I also have to sit with the labs for some, customized designing parts of it. And once these specialized pieces are delivered, we deliver it to the patients, and we have to adjust the bites. Then we have to see if, how it's sitting in the mouth, having an equalized balanced occlusion and all of those things. So this is the process of it.
Beautiful. So what is the age range of the patients that you see these problems or these issues are happening currently?
I would say majority from say 18 onwards. Okay, but you will see 18 to maybe 35, 40 peaks. Okay. Then you will again have a little break. Then you will see a lot in also menopausal women. Because that's the time hormones are acting up, muscular functions are getting weak, clenching, grinding, postures, all of that start changing at that age. So that's again an area where it peaks a lot.
Wow. And do you think that usage of the screens or usage of mobile phones is causing a lot of changes, postural changes, which is leading into this?
Like we all have sedentary lifestyles, right?
Yeah.
Like it's a must that every patient that walks into my clinic, I try my level best to kind of make them understand the importance of exercise. Like I don't just want you all to just go for a walk or yoga, but today strengthening, looking at your posture, getting it corrected, understand, because eventually this is lifestyle. Like this is what is going to make you sturdy. This is what is going to make you go on your holidays, go trek around mountains at 60 and 70. You don't want to be sitting stranded in their homes watching TV and all of that.
True.
Right? Like
True. So you actually you activate them, like you tell them and push them towards a better lifestyle.
Yes.
Superb. So what do you suggest to the dentists out there if they want to know about this field more? Like where do they start? Like is there something that they can take help from?
I think they all need to just go for their trainings then.
Okay.
Unfortunately, we don't have much of trainings in India. I haven't come across anything really good over here yet. So they will have to travel internationally to acquire, these level of trainings. If not, look out for like some webinars, seminars, whatever keep coming in. There is a lot of information on the internet also. If nothing at all, just open YouTube, just watch some videos on TMJ, right?
Yeah.
Like how to read the CBCTs,
Yeah.
how to, diagnose a TMJ, what is actually happening. We, as dentists, we don't even know what is displacement, where it happens. We've
Yeah.
not been taught.
Yes.
It's
yes.
just, it's very sad that we've not been taught that
True,
also. We don't know
true.
the actual location of the TMJ also,
True,
like how it's
true.
supposed to be normal, not normal. So these kind of very basic generic videos are there on YouTube, honestly, because patients who walk in, they walk in with knowledge more than doctors sometimes. I'm like, okay, you know it all. I don't need to explain you. I'm getting straight to
doctors.
the treatment plan.
Yeah. Superb. Superb. So now coming to the tongue ties, like one of your specialties that you do. Like what is the correct age to diagnose a tongue tie? Is it from the childhood itself? Or do patients face problems if it is not treated?
Right. Now, see, I treat everyone from infancy, children to adults on tongue ties. 100% if it's, caught hold of at infancy, much easier for that child as well, right? But I don't go looking in for tongue ties all the way, because
Okay.
that will lead to overdiagnosis.
Okay.
Okay. Someone who's facing a problem will always walk in towards you and ask you that I'm having X problems. Do you think I have a tongue tie?
Okay.
Is when you examine it. Do you really think it's coming because of the tongue tie? Do you really think it is the jaw position? Do you think the body is causing those problems? Then don't treat it.
Okay.
Only if it is really the tongue tie, then treat it.
Wow.
Yeah. Children definitely, because of if they have tongue ties, I would say the jaw structure doesn't develop well.
Okay.
They start getting a lot of nasal congestion. Then develops tonsils, adenoids, mouth breathing, snoring. Now, when this cycle of problems start, you don't get quality sleep.
Okay.
When you don't get deep quality sleep, these kids go into ADHD, signs and symptoms like that. Like it would be attention deficits. You always say, आजकल के बच्चे बहुत hyperactive हैं.
Yeah.
Why do we say that? Because 90% kids today are mouth breathing. A lot of kids are mouth breathing. We teach them basic hygiene,
Okay.
but we fail to teach basic nasal hygiene.
Wow.
What is basic nasal hygiene? Breathing through the nose is basic nasal hygiene, right? So we want to kind of reinstill that habit into them. Because we do not want our kids to have attention deficits, concentration, lack of concentration.
Yeah.
Very similar symptoms to ADHD. Some even get diagnosed as ADHD. And 90% of your brain development is until like 5 and 6 years of age.
Yeah.
So you really want to intervene if you're seeing these kind of symptoms in them.
Okay.
Adults who come, they usually will have a lot of postural problems, of course, airway issues, I would say. And some may also describe that we have speech problems since a very long time. Now we lack confidence.
Okay.
So that is one common point. Breathing is one of the common areas for adults that they seek out help for.
Okay. So as you mentioned that breathing is it is never taught to someone. Like, there are a lot of mouth breathers increasing. There are few tips which you can give from your end so that people can check their breathing and maybe practice those tips and get into better breathing.
Absolutely. I think 3 goals that everyone should remember is your tongue has to entirely rest in the roof of the mouth.
Okay.
It cannot be just the tip of the tongue or the middle of the tongue. The whole tip, middle and the back has to rest on the roof. Okay. Mouth always has to be closed and breathe from the nose. So simple nose clearing exercises like Anulom Vilom, Jalneti. Yoga bases in India talks all the time about breathing. Breathing is eventually the soul of everything, right?
Wow.
So I would say that's yoga, Anulom Vilom. Kids, I make them do a lot of humming sometimes. Humming develops a lot of nitric oxide. So that helps with a lot of nose opening. I make them do jalneti sometimes. I make them do some breath holds, but in more fun ways to make it more easier for them to follow through at home. Like I remember there was a game when we were kids, where we used to take a straw, suck a chana in, and put it in another bowl.
Yes.
So I would put those bowls apart for them to just hold that breath and go and put that chana on a different bowl. Just make it a little more entertaining for them. And make them understand what breath holding is like. You can use slitted mouth tapes. Don't use the full mouth tape without doctor advice, I would say, but slitted mouth tapes are okay to use. So these are small things that you can practice or teach as nasal hygiene, or what is good breathing today. This is what we can teach them.
Beautiful. So that's really helpful, Dr. Ankita. And then coming on to myofunctional therapy, that is the third topic that you have, right? So is that something only for kids, or
no, a lot of my adults do it.
Wow.
Okay, so myofunctional therapy is purely exercises. It involves exercises of the tongue, face, jaw muscles, throat muscles, soft palate muscles. Some areas which we never look at exercising, right? So these are the areas which get really weak. They don't understand how to position the tongue on the roof of the mouth, because the tongue muscle is it's just not strong. There is no tone in it. So we need to develop tone in it to make it reach on the roof of the mouth and slowly start building up their awareness towards it.
Wow.
So that's how.
That's amazing.
So it really helps with sleep apnea, snoring, mouth breathing also. In fact, most of my patients with myofunctional therapy, even with TMJ, they say that jaw pain has decreased.
Wow.
Their flare-ups start going down. So this is the advantage that they get with exercises.
Agreed.
The only part of it is, I think, motivation.
You're supposed to do it every day, or
it just takes 5 minutes, but exercise is an area of motivation. They just need to dedicate themselves to it.
So these exercises, once you give an orthotic or this thing, it should be continued yet, or maybe you can stop them post you your bite is adjusted or your TMJ is adjusted. Post that you should stop, something like that.
So what I do is start off with exercises, continue with my other treatments in between, end off with exercises, and then give them some maintenance kind of exercises. So which they can do even once a week or twice a week and maintain that strength. Now today, imagine if you're going to the gym, you're learning how to squat. You're so amazing at your squats, but 3 months, 4 months, you've stopped doing it. Do you think you're going to acquire the same strength again? No, right? You've lost some strength to it. So if you can even do little maintenance towards it, that would be amazing.
Beautiful. So now sleep, one of the topics is your sleep corrections or treating the sleep apneas.
Right.
How serious are these in India? I would say, how serious of a problem sleep apnea is in India?
Sleep and breathing are the only problems that can lead to other diseases in our body.
Wow.
Poor quality sleep, mental health goes for a toss. Poor quality sleep, lifestyle diseases, diabetes, cardiovascular diseases, hormonal issues, everything is, deep sleep is healing, immunity, hormones, growth factors, everything is released during this time. Your body repairs and regenerates in deep sleep.
Agreed.
So if we are not looking at quality sleep, because when you ask someone, are you sleeping well? They will say, yeah, I'm sleeping well. Do you think, are you getting quality sleep? I think so. But no one will know what is quality sleep, right? That's when your questionnaires get important. You need to just start. Someone who's tossing and turning a lot in sleep. Someone who's sleeping with an open mouth. Someone sleeping with an extended neck. I would say like a froggy. Some kids sleep like a froggy, or someone's always on his tummy sleeping, These are the people whose breathing is definitely affected. And these are, compensatory positions that they use to breathe better. And these are the people who will always have poor quality sleep. Now, as a dentist, what can we do?
Yes.
Right? Where is breathing affected from? I would say this whole thing is your airway under here. If you see anything in the nose or your sinuses, please refer it out to your ENTs.
Okay.
If you see anything with the jaw structure,
Yeah.
it's your area of work to look into. If you
Yes.
see anything with the tongue structure, again, your area of work to look into, right?
Yeah.
Anything with the throat, again, back to the ENT. But I would say 80% cases are this.
Jaw.
And how are we missing out as dentists? 80% cases are jaw structure. And I would say out of those 80, 60 will be lower jaw retrusion.
Wow. Wow.
So many of these cases start to show up, or even the TMJ cases, after poor braces or poor orthodontics.
Okay.
Why? Because traditionally, it's not even the fault of the orthodontist.
Yeah.
This is what we've been taught. We've been taught retraction, retractive orthodontics. The more you
Yeah.
retract, you're reducing tongue space, you're reducing airway, you're pushing the joints behind.
Yeah.
So that's when these patients come back with history. Yes, this problem started after braces. So it's not the braces which are wrong, but it's just the philosophy of braces also needs to change a bit,
Agreed.
where we need to look into like, how do we grow everything forward?
Agreed.
Nothing should be retractive.
Wow. Wow. So there should be an awareness even with the orthodontist is what you're suggesting, like, and every case is different, like, every case needs to be treated differently. So as I saw on your website, you have a very holistic approach. You have ENTs on panel, you have
Yeah.
orthodontist on panel, you have a physiotherapist on panel.
Yeah.
It's very important to build a team, like,
That's important.
Yeah?
Yeah.
So what do you want to tell about your team? Like, how do you believe in teamwork and how have you
I
created?
have been blessed with working with the best of the people around, I feel. And also it's a vibe, right? Like that
Yeah.
you give to the opposite person and the opposite person also gives you, right?
Totally agree.
My intention is always to just help my patients around. In whatever way possible.
Yeah.
So I would go out of my way to actually kind of look into what else is there over here. How can I help them better?
Yeah.
What is
Yeah.
more that I can see over here? And that's how I kind of just pick up a phone, just talk to someone. Do you think, doc, you can do something at this level over here? This is
Yeah.
where I'm seeing the problem.
Yeah.
Do you think your involvement will make any difference to the patient? Let's keep me in the loop of what's happening, and just go ahead, connect, network with people. You will see that there are a lot of open-minded doctors as well who will be willing
Wow.
to kind of look into the way you want to look at things. It's not like everyone's restricted.
Yeah, who share the same vision as you to treat the patient, like to go out of the way and treat the patients.
Exactly.
Beautiful, beautiful. So any advice that you want to give to the dentists here listening to that, that certain things or certain diagnosis points or like consultation, as you said, your consultations are the longest.
Yeah.
So any advice to the dentist
I
that
would
you
say
want to give?
explain your patients. Don't look at conversions. Conversions will happen automatically.
Wow.
Give them information. They need knowledge.
Yeah.
So you need to up your knowledge to give them knowledge.
Okay.
The minute they get confident that, oh, doctor's making sense, is
Agreed.
when they're going to listen to you.
Agreed.
So I would just say, just be very open-minded, acquire great knowledge. Don't hesitate to pick up a phone, ask someone if you don't know something. What's the big deal? A lot of us don't know. Even I don't know sometimes so many things. Just because, I didn't understand this. Why is this happening? What's
Yeah.
wrong in it?
Yeah.
Just every case is different. Sometimes you just learn.
Yeah.
So just don't hesitate, learn, explain your patients,
Yeah.
and I'm sure you'll do wonders with it.
Wow, beautiful. Because it does happen sometimes that, you have certain missing back teeth. Patient is just showing from the front teeth. And you tell the patient that, do you have backache sometimes? And the patient is so surprised. Then how does the dentist know about this? So it's
Exactly.
very important to up your knowledge so that you
Exactly.
can pinpoint that symptom that patient is suffering and no one else is able to answer.
Exactly.
Why are they suffering?
Exactly.
Yeah.
Exactly.
Yeah,
That's
beautiful,
correct.
beautiful. So, any 5 things that you want to give out to the public, who's the common public, or maybe they can observe in themselves that these are the problems that are caused by my TMJ or my tongue tie or my this is what is causing my sleep. Like anything that as a commoner I can observe in myself.
Right. I would say if you have chronic neck stiffness,
Okay.
then and you have been visiting the physiotherapist very often and you find temporary relief, again you have to go. Please go visit, some holistic dentist or ask your dentist about it. Sometimes some of their regular dentists might be also aware about,
Yeah.
where is it coming from.
Yeah.
That's one of the key things.
Yeah.
I would say if they're clenching and grinding, they should speak to the dentist about it. If they are snoring, mouth breathing, having signs of sleep apnea, they should again speak to the dentist about it. Any clicking or jaw pains, that's very obvious for a patient to notice,
Yeah.
hey, I think I'm doing all of these things. Chronic headaches and migraines,
Yeah.
again, that's a very common symptom that patients can look into.
Wow.
Yeah.
Wow.
So I think we
I think we've
listed out
covered
like 5 most
4,
common
yeah.
areas. But I would strongly advise every patient, you have these problems or you don't have these problems, please look at a clean diet.
Okay.
That doesn't mean that you do not enjoy your meals out or you do not enjoy your weekends, but there's
Yeah.
something called as 80-20.
Okay.
And 80% sincerity, 20%
yeah.
insincerity. It's okay,
Yeah.
But I would say clean diet, because that
Okay.
is where a lot of inflammation in the body comes from.
Okay.
And inflammation is the root cause of a lot of these diseases as well as a lot of lifestyle diseases in your body.
Okay.
Workouts are a must in every form. Posturally, we are all living sedentary lifestyles, sitting on the mobile phones.
Yeah.
Unfortunately, our work lives are like that. So you
Yeah.
got to get up, stretch your spine,
Yes.
make it move forward, make it
Yeah.
move backward.
Yeah.
You go
Just quick
strengthen your
exercises.
muscles. Just
Yeah.
even if it means 15 minutes a day, okay, start with that much. That is also okay. But just focus on that. And third most common thing that I want the patients to focus on, good breathing and sleep. Even if you can dedicate 5 to 10 minutes.
Okay.
Even before bedtime, you will see that you get quality sleep. You will definitely see that, things change.
Wow.
Things change.
Wow, beautiful. So I think we come to an end to our podcast, Dr. Ankita, and I hope you enjoyed.
I totally enjoyed, and I just hope that our audience is going to enjoy it.
Definitely.
And they have some great takebacks from you.
Definitely, I'm sure. And Dr. Ankita, I would like to request you, like if people out there want to connect to you, they can connect to you through your whatever handles or...
So they can connect on Instagram, it's Dr._Ankita Shah.
Okay.
They can connect on emails, it's info@dentician, DENTICIAN.in. They can even connect with the clinic contact numbers, it's 98207 37209. So they can reach out at many places wherever they feel like, and it should be okay.
Thank you so much. Thank you, Ankita.
Thank you, Jaisal. It was wonderful.
Thank you.